Good day, this is Dr. Koerper with a few comments about tonsillectomies. Some people might have questions about the procedure of tonsillectomy, and I wanted to give a brief overview. First of all, this is usually done in an outpatient setting, so that means you could come in day of surgery and go home after the surgery. Most tonsillectomy patients are children or young adults, but there are occasionally adults who receive this procedure. As anesthesiologists, we would like our patients to have empty stomachs before we put them to sleep. We do not want things in the stomach to be aspirated into the lungs, which can cause severe problems. So usually the recommendation is no eating or drinking anything after midnight. Then you show up for your procedure. In the case of younger children, as young adults, a sedative can be given orally to mellow the patients out just a little bit. Also, what we do is we take the smaller children back to the operating room and we put them to sleep with a mask. The adults get an IV started in the preoperative area, and we use that IV to put the adults to sleep, giving them medicine in the IV in the operating room where they fall asleep. Then what we do is we put a breathing tube in to help the patients breathe while the ENT surgeon takes the tonsils out on both sides in the back of the mouth. With the children, we take them back there to the operating room and put them to sleep with a mask with anesthesia gas. This is really quick, and just a few breaths of the anesthesia gas, they'll quickly be amnestic and fall asleep. Then with the children, we start the IV after they're asleep and then put the breathing tube in. When the surgeon is done, we pull the breathing tube out and we go to the recovery room. In the IV, we've given medicine to try to prevent nausea, which is common after this procedure, especially when some of the patients swallow blood after the procedure. Patients wake up in the recovery room and then we give them back to their parents. There are risks with anesthesia, but fortunately the serious complications are very rare. This is Dr. Koerper. Good day.